Welcome, everybody. We are going to go ahead and get started. My name is Gina Thorne. I'm the Chief Marketing Officer for Simplifyance, and I'm pleased today to be joined with our Simplifyance leadership team. We have Parker Smith, who is the CEO, Braden Smith, Executive Vice President, and we have Nikki Reuter, who is the Director of Continuous Compliance. And today we're going to be speaking about value-based compliance. This workshop is 1 hour, and so it will be recorded and available for anyone after. So please be sure to reach out to us and let us know if you're interested in sharing this webinar with anyone else who wasn't able to attend today. We do invite you to ask questions, but please reserve questions at the end of the webinar. You can unmute yourself, but please during the presentation, if you can remain muted, that would be terrific. So let's get into it. I'm going to go ahead and turn it over to Parker to get started.
Hello, everybody. Thank you very much for attending today's webinar. This is the first of an extended series around a concept that I've developed called value-based compliance. So today's subject matter is the introductory concepts, and then also some upcoming regulatory changes of the way that behavioral health care is regulated in the state of Colorado. So as Gina mentioned, today who will be presenting is myself. I'm the founder and CEO of Simplifyance. My work history has been in behavioral healthcare for the last 10 years, first as a counselor, then as administrator and operator, and then in the world of regulation, compliance, quality improvement, and risk management. So with us today, we've got Nikki Rutger. She's our Director of Continuous Compliance. Nikki boasts over 20 years of QI and compliance background, mostly in inpatient psychiatric hospital settings. And we also have Braden Smith, Juris Doctorate, University of San Francisco School of Law graduate, who has a corporate healthcare background, mostly with Kaiser Permanente. He is the Executive Vice President of our organization. Who is Simplifyance? So we wanted to start off by establishing our organization's presence in the industry, who we are, what we do, and exactly what we have to offer. So Simplifyance is a mission-driven team of behavioral healthcare compliance professionals who help simplify the complex nature of accreditation and licensing. Our mission is to support the growth, development, and refinement of behavioral healthcare organizations seeking to make a positive impact on others. And our vision is a higher standard of safety and quality in healthcare. So we have 3 distinct services. We have project-based consulting, helping behavioral healthcare organizations become open, legally able to operate through licensure, and then go through the accreditation process, which is a requirement in this day and age if you want to be reimbursed for services. We also have a software platform that's web-based. It helps to automate and organize all of the accreditation and licensing activities that you're required to do per regulation. We also have a service add-on to the software. If you want a dedicated compliance specialist as a dedicated representative to be able to call and get help with compliance questions, changes in policies, questions about changes in regulation, so on and so forth. Those are the 3 areas that we support organizations. A quick brief on our team. I am the Chief Executive Officer, Braden, as mentioned, Executive Vice President. Tim Smith has over 40 years in business as an employee and entrepreneur business owner. He's our Chief Financial Officer. Sam Stein is our Chief Technology Officer. He's the architect of our platform, boasts over 40 years in the tech space, early employee at Sun Microsystems, graduate of Pepperdine, and has been in the entrepreneurial world for the last 20 plus years. We're proud to have Gina Thorne as our Chief Marketing Officer. She's been with us at multiple capacities, initially in an advisory role, but now with us at a executive C-suite level. Marley McGee is our Operations Manager. She's spent almost a decade working in the provider setting, both in operations and compliance. Sierra Paratori is our Licensing and Accreditation Manager. She really fits inside our consulting department. She's a previous employee of the Joint Commission and comes from the regulator background. Nikki, as mentioned, is our Director of Continuous Compliance, extensive amount of work history, especially as highlighted in the inpatient psychiatric realm. Trevor Stein is our lead developer. He has over a decade of experience with development and tech, and super proud to have him on our team, as well as Ayana Marshall. She's our product and operations specialist, and she supports on the software side of the business with onboarding and supporting new customers. Today's objectives, at the conclusion of the webinar, we want everybody to be able to reframe the current perceptions that they have about compliance in behavioral healthcare. We want to define what value-based compliance is and the core concepts behind it. We'd like to articulate and determine the return on investment of a healthy compliance program. We want to learn how quality reduces the need for quantity and volume. And then we're going to also assess how data transitions to impactful stories. And then at the final part of our presentation, we're going to give a little bit of information about the upcoming changes in Colorado behavioral healthcare and some of the ways that we can support your organization in moving through that. So before I give the value-based compliance definition as I see it, I wanted to just clarify some specific terms that roll up into our definition. So the way that we define compliance is acting in accordance with laws, regulations, and standards of compliance, whether it be through certification, accreditation, insurance reimbursement guidelines, so on and so forth. Safety is not just physical safety, but also mental and emotional safety, important in the understanding of safety as it relates to behavioral healthcare. And then culture, which is a very loaded word that can be used in a number of different ways, which we're going to unpack and explore at length. So culture, in the way that we see it, I think is nicely summarized by Julian Lute. The sum of your formal and informal systems of behaviors and values, all of which create an experience for your employees and customers. Value can be framed in two different contexts, one being numeric or measurable, like a price or dollar value, or also in the context of the importance to the individual or organization. So we wrap both contexts up into our definition. So the organizational values and the institutional commitment to them, as well as the financial impact through savings, earnings, and organizational and business valuation. So I've spent hours ruminating on the best way to properly define with words my understanding and belief around value-based compliance. And the best shot that I could take was an investment in cultural safety, quality improvement, and regulatory and compliance that provides measurable financial and social benefit to an organization. Our belief at Simplifyance is that compliance fosters a culture of safety. A culture of safety promotes quality of care. Quality care translates into successful outcomes, and successful outcomes equals organizational and community health, wellness, and prosperity. As most of us know and understand, value or outcomes-based care is the focus of behavioral healthcare moving forward. And we are certainly right on top of that with the industry. So safety first. Organizational health is built on the foundation of a culture of safety. This is really a term really coined by the Joint Commission. For those of you that have been through accreditation surveys before, it's interwoven into all the different sessions and all the different expectations from the standards of compliance. As mentioned before, this includes physical, mental, and emotional safety for both patients and staff. I think that this is a really important distinction, that the organization and the culture of safety that exists is not only in the way that the patients or clients are being treated, but also the way that the staff are treated and engaged with as well. Safety includes the financial security of the business, regardless of status. You can be a profit, for-profit, nonprofit, and government agency, but financial security is imperative to being able to operate and sustain growth over time. We believe that leadership is ultimately accountable for all outcomes, including the response to adverse outcomes. So there are a number of different situations that can occur in a behavioral healthcare setting. And we believe, in line with the Joint Commission's perspective, that leadership is really accountable for all outcomes, including the response to any adverse outcomes, as we know It is a complex environment. Certain things and incidents can occur, but the response to them and the mitigation of risk falls directly on leadership and response. A culture of safety increases institutional confidence across all departments. When an organization is committed to their culture and their safety, we see a collective institutional confidence from the patients, from the staff, and all of the other stakeholders involved, including payers. Joint Commission recently published a third-party survey that discovered a 623% return on investment of accreditation. And what was interesting about this study is the majority of programs found that the standards related to HR and personnel reduced attrition, increased retention, and we're going to go ahead and drop a link to this third-party study in the chat. So if you'd like to learn more about how they came to this number, you can dive right into that. You know, the higher that you get up in leadership and in especially larger organizations, return on investment really becomes the main conversation. And so in the value-based compliance model, we want to ensure that there's a return on the investment of time, effort, energy, and resources. And we wanted to demonstrate some of the contributing factors to that return on investment. So as we mentioned, the independent study shows a huge return on investment of becoming accredited. And really in the environment that we're in now, it just is a mandatory activity for the business to perform and be able to retain that certification or accreditation. It ensures the organization's ability to legally operate. If you're not in good standing with your license or with your payer sources, then your business is not functional. Accreditation and licensing in good standing, quality care increases eligibility for reimbursement by third-party payers and can be used to negotiate increased reimbursement rates through in-network contracts and through other avenues. There are greater financial opportunities, like I had mentioned, through earning certifications and accreditations. And as we continue to see the evolvement of our industry, the more ways that an organization can demonstrate compliance, quality of care, and outcomes, the greater their opportunities will be for funding, for payers, and in a number of different ways through marketing and sales as well. One of the main returns on investment that we see is an increase in staff competency in compliance management. So a clear understanding of expectations, policies, procedures, et cetera, is going to increase the staff's ability to perform their duties and responsibilities with confidence, to respond to incidents in real time or behaviors that are being exhibited that need to be triaged, whether it be through de-escalation or a different modality such as motivational interviewing. One of the main, if not the main, returns on investment is the reinforced quality of care and patient safety. As we had previously mentioned and will continue to, there is a direct impact in a number of different ways from demonstrated quality care. So we want to jump into this notion of quality versus quantity. And one of the key performance indicators for a behavioral healthcare organization, which is fairly common knowledge, is the average daily census, or the amount of admissions that are processed over the course of a period of time, whether it be a quarter or a year or a set of years. Obviously, you know, getting admissions and enrollments is a very important part of sustaining and growing the organization. But we'd like to dive a little deeper into how an approach to quality and an investment in such reduces the need for as much volume and admissions and enrollments, and really focusing on the individuals that do come through and the way that they're being treated as it kind of rolls up into this larger, you know, financial picture and outcomes and quality picture as well. So well-documented quality care increases average patient lengths of stay and positions both utilization review and revenue cycle management for success. An interesting clinician that, you know, is a colleague of mine, I won't mention his name, has really even referred to a lack of documentation or poor documentation being, you know, synonymous with stealing from the company. You know, notes and documentation on the medical clinical sides are oftentimes, the source of reimbursement for organizations. They are the information that utilization review needs to be able to utilize in order to get more days approved or to move people through levels of care in a way that really supports them in their social and recovery efforts. So quality also includes responsiveness to staff and patient feedback, which in turn increases the institutional confidence. We've heard story after story of effective measurements of feedback, whether it be through staff and through patients, informing changes in the way that policies and procedures are written, service offerings are delivered, amenities and ancillary services are effectively instituted that really responds to the customer voice and the employee voice. And organizations that are not collecting this data or using this data are missing out on enormous opportunities to be able to continue to evolve and graduate into new ways of delivering services, processing enrollments, discharges, referrals. The list goes on and on. Measurement of outcomes and actionable response can be leveraged with payers and utilized in marketing efforts. So not only is evaluating and utilizing outcomes to direct treatment plans and patient care, but also it can be leveraged in a number of different ways to support the business, whether it be through marketing efforts or also in negotiations with payers, whether it be in network contracting, and other different sources of reimbursement as well. This may be an obvious notion, but I think is oftentimes overlooked. Poor quality of care decreases staff retention, reduces patients' average length of stay, and overall decreases the positive trajectory of outcomes that we're really looking for and the other stakeholders are as well. Reputation in behavioral healthcare is key. It is a very large market, but those that are represented in the public sphere are not super expansive. And so, maintaining your reputation is extremely important. And that goes for any vendor, whether it be billing, marketing, the providers, organizations like consulting groups such as us. So we're very fortunate in that the work that we've done has come in return to great reputation for all of the success that we've had. We've had 100% success rate with every licensing and accreditation project that we've ever worked on. And we're really proud of that. And the industry and our reputation is reflected of that directly. So the next concept that is a very important key component of value-based care is the collection, aggregation, and reporting, and then use of data to drive decisions. So any organization that you see of a significant size, whether it be a hospital or a hospital system or a large behavioral healthcare network, many, if not most of the decisions are made through the analyzation of data. Data can be collected through different measurement tools across every department, not only on the clinical and medical side, but facilities, medication management, so on and so forth. If you're not currently collecting and aggregating and reporting data, not only are you out of compliance, but you're also missing out on a number of different opportunities to understand the narrative and the story that your data is telling as it relates to your organizational success and the individual success, both on the employee and client level. Historically, it has been challenging to try to properly define outcomes in behavioral healthcare, but the industry is rapidly changing in that department. So in other forms of healthcare, measuring success is fairly simple. If you break your arm, you can go through a simple procedure. You can wear a cast for 3 to 6 weeks, and the outcome is clear that it's been successful if you have a healed arm. If someone has a complex mental health and substance misuse issue, trying to define an episode of treatment and the level of success that it has on the individual can be extremely difficult to measure. There may be an individual that comes through your program who does really well, quote unquote, complies with all of the program expectations and participation requirements, shows up to all their sessions, contributes in their groups and their individual and their family sessions, and then goes back out into the world and struggles, and falls back into some of their old patterns. Whereas we also see episodes of care where someone struggles and behaviorally they challenge the organization. They may come into situations where, they may look at being transferred to a different level of care based on their behaviors. And so, being able to utilize the evidence-based outcomes measurements that have been developed by clinicians and physicians, doctors and, engineers and a number of other different stakeholders in our industry is really helping us to use self-reported data from the clients and the patients to be able to educate our programs and our larger behavioral healthcare infrastructure on what are some of the activities that we can perform to really measure and then support and pivot in the way that we're providing care to meet the individualized needs of the individual, which looks different for every person. We're all a different calculation of biological, sociological, and psychological experiences, both on a biological level and a social level. And the way that we're treated needs to be unique. And at an institutional level, especially in larger organizations, it can be very difficult to achieve that. But if you're applying and utilizing these measurements, we can also provide a link in our chat when we get a little further down the road in terms of, what measurement tools are provided by organizations like CARF and the Joint Commission that are approved for their compliance standards, and can really help to capture important information about what your clients and your patients need in order to continually be treated in a very personal way that supports both of their recovery and their social life, moving past treatment. So incident management, medication incidents, and the data that comes really narrates the organizational issues and opportunities. So a notion that Braden had brought to the table, he worked in Kaiser Permanente's security compliance department for a number of years, is that incident reports and medication reports can serve as the mulch for the organization's improvement and growth. So that information about behavioral health issues or facilities issues, any kind of incident report that comes through of an adverse outcome or a situation that escalated, what have you, is valuable information for the organization to be able to evaluate and to understand and to be able to adjust accordingly to meet the needs of the patient population. And we especially see in the early stages of organizational life cycle that this is especially important because, at the end of the day, you don't know what you don't know. And there are certain situations that no one has encountered, even if the collective, experience is, hundreds of years or more. As we know in behavioral healthcare, it seems that something new happens every day. And the way that we respond to that and we use that data and that information is really what crafts the opportunities of our future and mitigates the risk of those instances happening on a reoccurring basis. As I had mentioned before, that will continue to be messaged throughout our webinar series, is data is what you can leverage in payer negotiations and in marketing efforts, along with grant writing, making sure that you can continue to fund your organization as it continues to provide services. Not all facilities generate profit. Not all organizations are built to be able to generate profit or financial gain. We see a lot of community-based programs, government-based programs, really being a public service to the community. And it's important for those organizations as well to use their data to be able to advocate for the funding to be able to keep those facilities open and continue to have a positive impact in their community. Successful organizations base their decisions on data. If you look at a hospital system or a large organization, they spend millions of dollars per year on data collection and analytics. And it's because they know that that data will properly inform the right decisions for them to continue to evolve and pivot and expand and grow, whether it be to go deeper in the market that they're in, get into new markets, or add levels of care and locations. So my question or call to action, or at least one of them during this webinar, is really to task you as an organization with really taking a look in the mirror and saying, what messages are we communicating to our organization about our approach to compliance and the program or the compliance program as a whole? One of the parts of going through the Joint Commission accreditation that I appreciated in my first go around was that a lot of the standards help to provide a framework of quality and safety that my lack or our lack of experience would never be able to have crafted. So it served as a guidebook, it served as a playbook. And during my time as director of operations at North Star, we really bought in to not only complying with the standards, but really trying to make them as meaningful as possible in the way that we engaged with our clients and the ways that we engaged with our patients, the ways that we engage with the families and all the other different stakeholders, including the insurance companies. So I really like this quote from Lisa Interligi, regulatory reforms and changing community expectations about organizational behavior has increased the emphasis on a role of culture and organizational compliance. So the way that your organization approaches compliance and the system as a whole is going to have a direct and palpable impact on the culture as a whole. And so as we see the evolvement and expansion of the behavioral healthcare industry, what we're also seeing is an increase in regulation, an increase for the need for compliance. And you see, a lot of the new players entering the space, whether it be through private equity money or for the government funding that's been allocated for this. Compliance is really a cornerstone of evaluating the organization's value, the organization's success, their impact, and a number of other factors as well. So I challenge each of you to take a look at how you view compliance and what kind of messages that you're communicating to your staff and how the staff is responding to that. So one of the opportunities that we felt like we could really capitalize on during our time today is doing a brief demonstration of our software platform. We really wanted to give just a simple, quick view into some of the key features. For any of you that are interested in doing a deeper live demo or learning more about our software platform and its functionality, we'd be happy to do so. But I'll give a quick rundown from a high level standpoint. So any organization that utilizes our software has its own unique HIPAA compliant instance. Similar to an EHR, it's in a separate bucket than any other organization. So the data that's collected and analyzed within the system is safe and confidential from any other type of organization or entity. Not everyone in your organization needs to be a user of this platform, but everyone in your organization can come to the login page to fill out either a general incident or a medication incident. They can do so anonymously or by name. This form is fully customizable to meet the needs of your program and the recurring incidents that happen. When an incident report is completed, based on the level of severity, a timeline task is created within the system for follow-up. One of the problems we see in our industry is that incident reports fall by the wayside. They oftentimes are completed and not followed up on. So our system really creates more of an accountability loop for the organization to properly follow up on every incident that gets filed, which, as we described, really can be the mulch for an organization's growth. You can drag and drop files and attest that it's accurate to your best knowledge. Incident report form or medication error report form, very, very similar to what we see there. One of the exciting components about not only these forms, but all the forms in our system is that all the data that is collected is automatically aggregated and can produce reports from any time range, making evaluation of incident reports, environment of care data, what have you, super seamless and simple. So leadership can really effectively analyze these reports. So inside the system, we see a specific cards for each type of incident, easily filtered by severity, easily searched through keywords. A high-level overview is produced here. We see Braden was the one that submitted the incident report number, date and time, who was involved, the level of severity, and the incident type. We can easily click single page and see a full description. And we can also click on this clipboard to effectively follow up on that incident, utilizing our unique 4-digit PIN to authenticate and timestamp that document. So this really supports the culture of safety through the ongoing effort of incident management reporting, and also the effective follow-up, which is where we see a lot of gaps. The task management page is extremely important. So all of your requirements for accreditation, whether you have Joint Commission or CARF, come right out of the box, built on the timeframes of when they need to be completed. So as most of us know, environment of care rounds or tours is an activity based on your level of care that you have to do at a certain frequency. What you can see here in the actual task is another one of these dynamic forms. Again, fully customizable, automatically aggregates all the data that's collected. So if you want to run a quarterly or an annual report on anything that you're collecting data on, whether it be based on the regulation requirements or in a task that you create for yourself, everything there is at your fingertips, very, very customizable. What we're loving about our system is that the creative and expert geniuses at each of the programs that we're working with are coming up with new ways to collect data, to evaluate it, and to be able to utilize that in their efforts of decision-making. One of the requirements of Joint Commission, CARF, licensing is that you make known your policies and procedures and that they're accessible to all of your staff. So in our library page, what we have is a very easily navigatable repository of policies, procedures. They can be searched through department. And really, this can be easily accessible through phone or iPad or computer. So if you wanted to set permission levels for the members of your organization, personnel, that you could have it so they only see the library function, they log in just to be able to view policies and procedures, which can be done in real time. Electronic medical record systems have replaced paper-based documentation. We believe when it comes to compliance responsibilities that there should no longer be binders that are outdated, sitting around with policies and procedures that are fairly impossible to navigate. So for anyone in the organization to easily access at any time in real time policies and procedures, there is that opportunity through our system, which a lot of the organizations are just absolutely loving, because rule enforcement and policy adherence is just a lot more reasonable. We have a free resource library on the other side of this section of the website, which is really cool because we have performance improvement plan templates, fire safety management, culture of safety survey templates, really a number of different resources that have gone through Joint Commission and CARF surveys that have been approved from licensing bodies. So say you get a notification that indicates you're up to evaluate your annual infection prevention and control plan. You go to your active side, you open it up and you don't love it. You can toggle over into our free resource library, download the Word document, plug and play your organization's information, and then really customize and operationalize it to your program. So we won't get into all the other functionalities of the software. We do have integrations with our calendar, with Outlook, iCal, Google. So all of your activities and responsibilities can show up directly on your work calendar with a link that takes you right into the system, with the system taking you directly into that form that, again, although it be web-based, can be completed on a phone or a tablet or a computer. So just a little bit of a sneak peek here for everybody to be able to take a look at. And with that, we're going to kick it back over to Braden. And Braden is going to introduce some of the behavioral healthcare changes in Colorado and some of the impacts that that has on our industry here in Colorado as well. So Braden, you want to take it from here?
Yeah, thank you so much, Parker. And thank you to all of you for being here with us today. I really appreciate you taking the time to to learn a little bit more about Simplifyance and also some of the new upcoming and already just recently implemented changes in the behavioral healthcare landscape in Colorado. So Colorado behavioral health system has a couple of major changes that have either recently gone into effect or are going to be going into effect over the next few years. Two of the major changes are the standing up and licensing of behavioral health entities, or BHEs, and the creation of the Behavioral Health Administration, or the BHA. And we're going to go in a little bit more detail about both of these. Nikki is going to talk a little bit about the BHE changes, and then I'm going to resume speaking a bit more about the BHA changes. And just to let you know, this presentation is intended just to summarize some key points, and we're obviously very available to discuss in a little bit more depth with you on another more individualized call about your specific program and how these changes apply to you. So with that, I will go ahead and turn it over to Nikki to start us off with the BHE changes.
Thanks, Braden. Hi, everyone. So before this year, most mental health providers were licensed or are licensed through OBH. The behavioral health entity license is issued through CDPHE. So we've got a whole new state department involved, and that adds a level of complexity. It's important to note that the BHG license was conceptualized back in 2019 before the state decided to tackle behavioral health care reform. So we've got some additional confusion that unfortunately is probably going to continue over the next couple years as these changes are implemented and come into existence. But believe it or not, the idea was to simplify licensing for multiple types of community behavioral health providers with a more flexible single license type. So almost all mental health providers need to be licensed as BHEs with a couple of exceptions. The general rule of thumb is if you're licensed by OBH with a mental health designation, then you are required to get that BHE licensure. And you're also required to maintain the mental health designation on your existing licensure with OBH. So that's an important distinction. And the application deadline to start the BHG licensure process was July 1st of this year. So if you haven't started that licensure process by submitting a letter of intent with CDPHE, you're a little bit behind at this point, but you can still get started. Okay, could you switch the slide, please, Braden? Thanks. So it's important to note that BHG rules are pretty different than the OBH rules that most of the people in, I assume in this webinar, are already familiar with. They're written differently. There are multiple rules chapters that are applicable, and overall, they're more prescriptive than OBH rules. Life safety and environment of care rules are notable examples of being significantly more prescriptive, but there's a different set of client rights, there's a different prescribed grievance process, and different things are required to be reported as critical incidents. Importantly, both sets of rules are going to need to be maintained over the next couple years until BHG licensing authority is transferred to the BHA in 2024. So it's really important as you move through this licensing process to be careful when you go through the various regulatory requirements that will apply as you update your policies and your practice to meet those new CDPHE standards. And that can be kind of overwhelming, but it doesn't have to be. So I just want to mention, if this is something that you find overwhelming and you want or you need help with this process, that's something that we can help you with. We've created a gap analysis tool with all of the applicable rules chapters so we can help you assess your current policies and procedures. We can help with policy updates or the licensing process itself. And if that's something that is of interest, I just invite you to open a conversation with us and we'd be happy to walk through that with you. Bottom line, there's a lot of really great things happening in the state of Colorado, and it's going to take us a little while to adjust.
Thanks so much, Nikki.
Sure.
So in addition to the behavioral health entity changes, there's also a very large change happening in the formation of a new regulatory body called the Behavioral Health Administration. And the goal of this new administration, as Nikki mentioned, this was not quite thought of at the time the behavioral health entity stuff was being figured out. But the goal of this is to create a coordinated and cohesive, essentially one group that you can go to in the state that will help with all sorts of behavioral health care needs and do all of the regulation in the behavioral health care settings in the state of Colorado. So the Behavioral Health Care Administration is going to be actually actively handling most of the behavioral health care programs, compliance, grievance processes. There's a lot that goes into everything they're going to be doing, which is going to be demonstrated here on this next slide. So by July 1st, 2024, the recently passed act that has been signed by the governor requires the Behavioral Health Administration to establish things like a statewide behavioral health grievance system. And we're not exactly sure what that's going to look like yet, because right now there's a few different grievance systems depending on what type of grievance a client has in the state of Colorado. But again, to simplify things, they're trying to break that into one centralized regulator that you're able to file grievances with. A behavioral health performance monitoring system. Parker talked a lot in his slides about the importance of data and the importance of being able to have objective metrics on client care and how well people are able to progress in behavioral healthcare organizations. The state is actually looking to monitor that performance on a global level. So all providers will be submitting their performance sort of improvement amongst their clients to the state through whatever mechanism the state comes up with, which is not quite clear to us yet, but is certainly going to be unraveling over the next few years. A comprehensive behavioral health system, safety system net. Regionally based behavioral health administrative services organizations are going to be stood up as well. And then a couple of, I think, some of the biggest and most important changes is actually prior to this, we believed that on July 1st, 2023, the BHG would be doing all the licensing functions for renewal of behavioral health entity licenses. I've actually been working with some programs recently, and we've seen that OBH has been effectively replaced on a lot of the websites by BHA already. So rather than having to wait until July of next year to see this, we're already seeing BHA pop up all over the state of Colorado government websites. And they're actually, when you go to apply in the Ladders portal now, it says BHA instead of OBH, which is quite interesting to see that they're already bringing these things into effect. And they're certainly not waiting for the deadlines that were prescribed by the law to begin to implement these changes. And then finally, on July 1st, 2024, the BHA is going to be the official licensing authority for all behavioral health entities in the state of Colorado. So there's a lot of changes that are going to happen. And what we foresee is there's going to be a lot of regulatory code changes, and there's going to be a lot of push outs from the state about these new laws. And so that's something that we're very actively monitoring, because we have a lot of clients in the state of Colorado. It's a state that we got started in and we love very much. So we continue to want to work there and be able to assist all the organizations that we work with all these changes as they come about. And certainly, as Nikki mentioned, if you have any questions about the BHA or the BHE process, we're great people to reach out to. Parker, I'll go ahead and turn this back over to you. Thanks so much.
Thanks, Braden. Yeah, and I think, some notable organizations that we're already working with and have been for quite some time in the state of Colorado include Harmony Foundation, include All Points North Lodge, North Star Transitions. We work with Boulder Integrated Health, Flatirons Recovery, Women's Recovery has recently signed up with us as well. So we're excited to be working with them alongside a number of others in the behavioral health care arena. So I think that it's kind of an important understanding that, licensing in Colorado historically has not been as challenging as it could have been in maybe some other states, especially in the Northeast and some of the more liberal areas. But it is changing, and it is going to be enormously challenging to meet CDPHE and the Behavioral Health Administration's requirements. A lot of new regulations coming out. So important to stay on top of that now. Although 2024 seems like a long way down the road, there is going to be a crawl, walk, run to that date. So it's going to be mandatory for everybody to be in compliance, on or before then, and have the systems in place to be able to meet those regulations. So you don't get stuck in a position where the regulators are sending a cease and desist, issuing fines or anything that's going to be adverse to the organization. So we kind of want to summarize this webinar with the description of the services that we offer. Specifically, I had mentioned we do project-based consulting, so helping organizations earn or renew their licenses and accreditations. We do software as a service, so the platform that I had demonstrated is an affordable, cost-effective, web-based platform that is really structured in terms of fee based on the number of locations and levels of care you offer. It is not a pay-per-seat user-based model. And we're excited to be able to get this tool in the hands of organizations, whether they be small or large, because it can serve as a tool for an organization of whatever size. As I had mentioned before, we have an ongoing continuous compliance service. If you want a dedicated compliance specialist to be able to call for support, they're available for you to be able to walk through a number of different compliance related activities. Oftentimes, organizations have compliance responsibilities allocated towards folks that have never worked in that side of the industry or performed any of those duties and responsibilities. So providing those people with a resource at an affordable cost is a great way to support a culture of safety, to improve on the quality and the way that the systems are approached. So we are excited about all the different offerings that we have. As I had mentioned, we have 100% success rate in all of our project-based consulting with licensing and accreditation. And we have no intention for that ever to change. So we have intellectual property in the forms of project plans, Gantt charts. We take a very calculated approach to our projects, utilizing a team rather than just an individual. And again, very proud of the work that we've done. We've got a number of different references and case studies that we'd be happy to provide as well. So I'd like to open up the conversation now to any questions that folks have. If they do, we've got about 12 minutes left here. So I want to open up to the floor to anybody that has questions for Braden or Nikki or myself.
Hi, this is Gwen Henderson, and I have a question. When would an agency necessarily go for a Joint Commissions accreditation versus a CARF accreditation? There seems to be some confusion on when CARF is more viable or the Joint Commission is more viable than CARF.
Yeah, great question, Gwendolyn, and thank you for your attendance and participation. So all organizations are different. They have different means, different needs, they're structured differently, and the way that they pursue accreditation should be unique as well. And so for some organizations, the Joint Commission accreditation might be favorable. Some of the contributing factors would be your payer source. Some insurance companies or payers, reimbursers, whether it be Medicaid or statewide funding or through insurance companies, commercial or public, look for certain accreditations more than others. Oftentimes, it's a personal perspective as well for the organization, and some payer sources direct organizations to pursue either one or the other. And if that's where they're directing you, then that's probably the best path for you to go. So one of the areas that we're able to assist organizations is evaluating based on their structure, based on their levels of care, based on their financial plans and intentions. We're able to come alongside organizations to help make that decision with them. And not only to make that decision, but take them through that process. Another service offering that we have inside our consulting umbrella that I failed to mention earlier is an affordable compliance assessment to be able to gauge the organization's compliance with their accreditation requirements, or if they're not accredited yet, we can perform this affordable assessment to give them an indication of where they're already in compliance with standards, where they would need to be, and also determining what accreditation is going to be best for them. So that assessment is all remote, is done in multiple sessions that can be completed over the course of a few weeks. It's not over encumbering for the organization in terms of time and effort. And the pricing starts at $2,500 to get a full report of your accreditation health, and can be done prior to an accreditation, or if accreditation is already have been obtained. So it can look different for different providers. I think that there's definitely merit across both CARF and Joint Commission, and it really just depends on the organizational structure, the levels of care, and the payer source, I think, are the main contributing factors. So hopefully, Gwendolyn, that answers your question.
It did. Thank you very much.
Absolutely. Thank you. Other questions? We've got 9 minutes of opportunity for free consulting here. Anybody got any questions?
Can you walk through what the assessment entails?
Absolutely. So for each accreditation, whether it be Joint Commission or CARF, there's a set of chapters and a set of standards. So in our assessment process, we dive deeply into each of those chapters and the different departments that contribute towards those efforts. So we perform interviews and questions. We evaluate policies and procedures. We can review a sample set of medical records, HR files, and really all the information that would be applicable and contributing to the health of your accreditation standing. And so the report that you get is a gap analysis of the areas that you're currently out of compliance or need new systems. And that report can easily be translated into a work plan to help the organization close that gap, and really also informs, where the software platform that we have can benefit the organization in coming into compliance and ensuring that compliance is maintained over time. So hopefully, Tim, that answers your question about the assessment process. We've still got about 6 or 7 minutes here. Anybody else like to chime in with a question? Looks like Dinah's raising her hand. Dinah, please.
Yes. I appreciate everything that you were saying about materials to help convince management about the importance of accreditation and all of the different pieces and how that there can really be a return on investment. And I tried to use the link that Gina put up and was having troubles with that. Could you give me just a high level view other than what you just said of, why this is, you did a good job of talking about some of the underlying benefits, but just summarize what some of those benefits are?
Absolutely. So one of the concepts that I had brought in terms of the return on investment is the guideline of best practices. So best practices in terms of how personnel are managed, how client care is directed, quality care directed through standards of compliance and best practices, increases average length of stay, decreases discharges against medical advice. Both of these factors have a financial impact. Personnel, retention of personnel, recruiting of personnel, becoming an employment destination can really be impacted significantly by an organization's commitment to becoming accredited and maintaining those and really buying into the meaning behind it. So personnel, client and quality care, and then also payer source. So becoming accredited is a requirement for most commercial insurance payers to even initiate an application for an in-network contract. And even in the state of Maryland, it is a requirement to become accredited to even apply for a state license. So in at least one state and many more probably coming down the pipeline soon, accreditation will be mandatory even to become licensed and operate legally as an entity. So from an organizational viability, from a financial and payer perspective, and then from a quality of care and quality of management of personnel, I think would probably be at a high level the main contributing factors. And it looks like Gina also put a link in the chat where we could kind of dive deeper on the Joint Commission's website of ROI and the value of quality care. So hopefully, Dinah, that answers your question.
That was a great overview. And Gina, that link does work. Thank you so much. Appreciate it.
Absolutely. Hey, we got about 3 or so more minutes. Anybody else like to ask any questions? It's a great opportunity. All right. Well, if there's no further questions, we'd like to thank everybody for joining today. I think Gina's going to close us down. I did put a link to our website in the chat. It's www.simplifyance.com. You can look at all of our services, the software platform. It's an easy way to schedule a demo and learn more about what we do. So we're excited about this ongoing value-based compliance series. We'll look to provide one within the next month or two. And then starting in 2023, we will have this series running monthly, hosted by a number of different stakeholders in our organization, advisory board, and in the organization or in the industry as a whole. So Gina, I'll kick it over to you to close this off.
Thank you, Parker, Braden, and Nikki for your expertise. And thank you all for taking the time to spend with us this afternoon to learn about value-based compliance. As Parker mentioned, we are going to be offering this as an ongoing webinar series. Look for an updated version of our next topic in the coming month. Also, there is a survey that you will receive at the conclusion of this webinar. It will probably arrive in your inbox within 24 hours. We'd like to get your feedback on how you felt about the presentation, and then also to inquire about what your compliance needs are. So please be sure to share this information with others. Let folks know about who Simplifyance is and what we're offering. We're very excited to be a resource for you and your organization. Thank you all, and we'll be connecting again with you in the next month or two.